Hi everyone, my name is Sarah Barnes. I'm a senior at UNC Chapel Hill studying psychology and neuroscience. This summer, I worked with Dr. Paterno on a project examining how Medicaid expansion would help alleviate cancer health disparities in North Carolina. For my deliverable, I chose to do a TED Talk. In the United States, healthcare disparities have been prominently seen in marginalized populations. The cancer community is not exempt from this problem. Racial and ethnic disparities continue to persist. Biological, social, and health system determinants are all contributors to negative health outcomes, oftentimes for treatable conditions. People's health varies across and within states, as does access to health services and overall quality of care. North Carolina is one of the last 11 states that has chosen not to expand Medicaid when given the opportunity to do so on numerous occasions. Failing to do this has had significantly impacted rural access to healthcare. 82% of rural hospital closures nationwide in the last 5 years have been in non-expansion states. More specifically, in North Carolina, 6 rural hospitals have closed since 2010. And several others are at high risk of financial distress. Issues around cost affordability and access to care also contribute to inequities. According to the NIH, Black, Latinx, Hispanic, and AIN populations are less likely to have health insurance, more likely to face cost-related barriers to getting care, more likely to incur medical debt. As a result, these groups are less likely to receive annual preventative services such as vaccines, cancer screenings, and chronic disease management. Experiences of interpersonal racism and discrimination from clinicians are other barriers deterring this population from receiving care. These factors are only some examples of the structural economic suppressions that have created poor health outcomes for many marginalized populations. Federal, state, and local leaders have the power to improve and provide accessible healthcare coverage. Expansion of Medicaid in North Carolina would provide 600,000 more people in the state with healthcare coverage. It is time to address the inequities we have grown so accustomed to. Insurance status has been linked to differences in cancer treatment and outcomes. Uninsured North Carolinians are more likely to delay needed health care and lack access to preventative services. For example, breast cancer is often considered treatable when detected early, but is more likely to be diagnosed at a later stage in Black women. This emphasizes the importance of understanding the potential implications of healthcare policy within the U.S. cancer population. Medicaid expansion is associated with decreased uninsured rates, as well as improved cancer screening rates and increased early-stage cancer diagnosis. Cancer screening is the best way to find cancer at an early stage before symptoms appear or progress. Additionally, cancer prevention has been shown to reduce both the incidence of cancer and mortality. An essential determinant to access to preventative services, such as screening and early detection, is health insurance. While there are many programs such as the NBCCEDP that provide critical access to cancer screening for low-income uninsured or underinsured women, they are not a substitute for comprehensive insurance coverage. States that closed their coverage gap saw significantly lower mortality among newly diagnosed breast, colon, and lung cancer patients. Recognizing that cancer care quality may be associated with race in terms of socioeconomic status and health system factors could help policymakers identify strategies to meet this ongoing problem. A key contributor to healthcare access inequities is a lack of comprehensive insurance coverage. Insurance is necessary for getting needed healthcare without experiencing a major financial risk. Lower income and underinsured cancer patients are especially vulnerable to the high cost of cancer care and may be more likely to be from minority groups. States that have chosen to not expand Medicaid have contributed to the coverage gap. This occurs when a person's income is above the Medicaid eligibility but not high enough to afford private insurance. The population that falls in this gap often has limited income, which exacerbates the barriers already present when trying to navigate accessible healthcare services and medical care. Adopting the ACA's Medicaid expansion plan would expand Medicaid coverage to nearly all adults with incomes up to 138% of the federal poverty level and provide states with an enhanced federal matching rate. Altogether, expanding Medicaid in North Carolina would have not only a positive impact on the cancer population, but also alleviate other health disparities underserved communities are predominantly facing. The battle to pass Medicaid expansion in North Carolina has been a long one. My hope is that our state will take a step forward soon. Thank you for listening to my TED Talk.